Hello and welcome to another episode of A Closer Look. Thank you for joining us. On the morning of May 24th, a massive landslide descended upon Yambeli village in the Mulitaka LLG of Enga province. The devastation left behind a trail of destruction and despair as it reportedly claimed the lives of more than 160 individuals. The unprecedented tragedy received heartfelt response from the provincial, national and international fronts.
The local authorities in Enga has described the massive landslide in Mulitaka as an unprecedented natural disaster. The disaster hit Yambeli village at about 3 a.m. on the 24th of May, resulting in deaths over 160 and destruction of houses and other properties. The total land area affected by the landslide is around 200 square kilometers, which includes about 150 meters of the main highway from Wabeg to Pogera, which is completely destroyed by the landslide. The Enga provincial government deployed a rapid emergency response team comprising officers from the Provincial Disaster Office, Provincial Health Authority, Police, PNG Defence Force and Enga-based international organizations to the site to do impact assessment on the extent of the damages.
We've estimated the incident has affected 7,849 people. The population of the impacted area is estimated to be 7,849 at that present, which covers a total of 1,427 households. So as that figure shows, it's a significant impact area that has left a lot of people displaced, traumatized, injured, and importantly, as we expect, as we do the recovery measures, we expect to recover significant loss of human lives.
The national government, through the National Disaster Office, with the provincial and district, are focusing on relief supplies, shelter for the affected communities, and search and recovery.
Landslide, we prioritized search and rescue, immediate relief supplies, both food items and living utensils, temporary shelters for the impacted community, and obviously providing other emergency assistance. We've set up two care centers on both sides of the landslide, one at the Pogoro end and one at the Wabeg end of the landslide. Those facilities are at the current existing health center facilities, so we're building capacity, putting up our resources in those two areas to provide additional assistance that will be ongoing. We are very encouraged by the support we've been getting from both national and international partners.
The relief effort started with local businesses, government and international organizations supplying food rations, emergency shelter and other relief supplies to the affected communities. With the news of the landslide reaches the international communities, relief assistance has been provided from the international partners like the European Union, United Nations, Save the Children, the U.S. Embassy in PNG, JICA, Australian Aid and many more.
The European Union leaders have joined the other world leaders in expressing their shock, grief and condolences to the people of PNG following the latest disaster in Enga. The European Commissioner for Crisis Management, Mr. Renarci, had announced yesterday an initial 150,000 euros, or about 621,000 kina, in emergency assistance, which will be channeled through the humanitarian agencies on the ground already. Other individual EU member states are also preparing to send their support. Furthermore, the EU and its 27 member states could provide additional assistance through the EU Civil Protection Mechanism, which can be activated by the PNG authorities to a simple email request.
According to the provincial member for Enga, Sir Peter Ipatas, the national government has given 500,000 kina initially through the Office of National Disaster to set up and finance the relief efforts. Businesses within the country also assist in providing financial assistance. A donation of 1 million kina was given by the ICTSI, the leading terminal port operator in Papua New Guinea. Seipatas acknowledged the support from international partners and also businesses in the country. However, he emphasized that the landslide has affected the operation of the Porgera mine, but most importantly, affecting the people in Porgera because the road access has been cut off.
And then, of course, on the other side, we have got a beautiful landslide. The road is cut off. And the people on the other side, Porgera, and that area will soon run out of food because we can't get supplies across because of the road closure.
It's been more than 7 days since the landslide occurred and buried more than 160 people. According to Sir Peter Ipatas, he said in medical perspectives, the health team advised them that they can presume that all the people covered are dead.
From medical perspective, they told us that we can presume that all of them have passed away. But we are now having our public service and do interviews, find ways of exactly establishing how many have died. So they've got to get information, but that's a central location where people from the other side of the river also come and, stay, because this is the highway. So it's sort of a central meeting place for a lot of people. So that has to be established. So our public servants are now in the process of establishing that.
The site is unsafe at the moment as the landslide is very active. In order to fully recover the bodies and properties, a geotech assessment must be done to guarantee the recovery team to conduct their work. Until then, the loved ones of the people who have perished in the landslide are using spades to dig with the hope that they will recover their family members.
Unfortunately, the landslide is still unstable, so we have to get expertise from Port Moresby, and also have asked for Australians and New Zealanders to assist us with geotech people who will go out there and do a study so that we try and do everything safely.
The Enga provincial government has indicated in a report on the 29th of May, stating that so far 4 bodies have been found, with 6 segmented parts of the bodies have been recovered. They have set up Mulitaka Health Center as a command post, establishing a care center and working to improvise the main facility as a primary triage center. Layagam Hospital is the secondary care facility for more severe injuries, with a medical officer and ambulance on standby, and any further referral will be sent to Wabeg. With world leaders passing their condolences to the
Hello and welcome to another episode of A Closer Look. Thank you for joining us. On the morning of May 24th, a massive landslide descended upon Yambeli village in the Mulitaka LLG